Hello, everyone, and welcome to the final chapter, which makes it your favorite, but also it's everyone's favorite because it is reproductive systems and STDs. I love traumatizing students in every course I teach with as much as I can about STDs. Now, the good part about doing this lesson online is you don't have to worry about the professor seeing every time you giggle when I say penis and vagina today. So, starting off. Let's head into the two types of reproduction. So a lot of today will focus more on sexual reproduction, but I do want you to be aware that there are two types of reproduction. There's asexual and sexual. The difference between them is that with asexual reproduction, there is only one parent, okay? And usually because it is one parent, producing the offspring are then identical to that parent and identical to each other. And so a lot of times you see this as, for instance, budding yeast, or how bacteria can double their DNA and then split in half so that all of those cells, the original one, the new daughter offspring, they're all identical to each other. There's actually another form of asexual reproduction beyond, the binary fission of bacteria or the budding of yeast, and it's called parthenogenesis. That's a special form of asexual reproduction that's a modification of sexual reproduction. It's basically where an unfertilized egg develops into a complete individual. And you see that with some plants or nematodes, some fish, but it's not the most common type of replication. But when you think of asexual reproduction, I mainly want you to think of yeast and bacteria as two big examples. Then there's also sexual reproduction, and that is what humans use and many other organisms. Sexual reproduction is different from asexual in that now there are two parents. That's very valuable in biology because by having two parents in sexual reproduction, that gives more variety. You get mixture of genes, mixture of genetics, and that can create a whole bunch of new abilities and traits. Now, with sexual reproduction, there will be gonads and gametes. So the gonads are the sexual organs. There are the testes and ovaries. And then the gametes are the sex cells that these organs produce. Okay, so testes are the gonads that produce sperm as gametes. And then the ovaries are the female gonads that produce ova or eggs as their sex cells. The other terms I want you to know for sexual reproduction are copulation and fertilization. Copulation is simply the act of sex, so sexual union, penis meets vagina, for instance, whereas fertilization is when the gametes meet. So a sperm uniting with an egg to form that single cell zygote, whether it's internal or external, that is fertilization. Now, in addition to those types of reproduction, I want to point out that there are two different life history strategies you should know. There's the term oviparous and viviparous, and all you have to do is think about what the beginning of each of those words means. So when you see ovi, think ova or ovum, which is another way of saying egg. So with oviparous, that's where an egg is deposited or dropped into an external environment. So for instance, when birds release their eggs into an external environment, and that egg now develops outside of an organism's body. And that egg now ends up requiring extra protection because it's developing in the environment. So eggs in an oviparous organism will have extra layers. They'll have an extra embryonic membrane around it to prevent it from drying out, and they'll have a very hard shell. Okay, that's why when you encounter bird eggs, for instance, they are very hard shelled because that's a form of protection for their external environment. Whereas viviparous, that's the strategy that humans use. That's where fertilization and development of the young offspring occurs internally, so within the mother. And in that case, there is not the need for the extra hard protection outside. Instead, there's the need for a structure that allows the internal exchange of materials from that mother to that fetus. And in the case of humans, that is a placenta. Okay, so note the difference between oviparous and viviparous, so the egg developing outside of an organism versus inside, and the implications that has. So oviparous, they need a hard protective shell and an extra membrane to prevent drying out, whereas viviparous, they need a placenta. They have to be able to internally exchange materials. Now, when we talk about reproduction, I want to point out the male versus female reproductive systems. So I want you to know what the significance of each of these terms means. So first off, of course, the penis is the organ of copulation, meaning the organ for sexual intercourse. And when there is increased blood flow to that organ, that leads to an erection, and then ultimately the emission and expulsion of semen, which you call ejaculation. Now, in addition to the penis, it's important to also know the gonads, which are the paired testes, and they're involved with the production of sperm, so the production of the male gametes. But in addition to that, I want you to put a little star next to sperm and say, and hormones, okay? Testes do not just produce sperm, but they also produce hormones, for instance, testosterone, right? Very important hormone. Then there is the scrotum, and the scrotum is the protective sac that's covering those gonads, covering those testes. And having the scrotum is very important for this kind of reproductive system because think about it. If that organ is responsible for producing sperm, very delicate, important gamete, well, you don't want that organ to end up overheating. So it is external in a sense, it's sticking out of the body, but it is a temperature-controlled sac to protect those testes. Now, there's also the epididymis. So you notice the testes here, the epididymis right here up against the testes. The epididymis is the site of sperm maturation, so where the sperm now that has been produced in the testes now matures. And then you have the vas deferens, right, extending away from the epididymis, because the vas deferens now conduct the sperm. They allow for the flow of the sperm, and they do that via contractions. You also, as part of the male reproductive system, have the prostate gland, as well as seminal vesicles and the bulbourethra glands. And so when you hear glands, that's usually relating to some sort of secretion. In this case, all of these are contributing to the fluid, so contributing fluid to semen that allows the semen to be mobilized, to allow it to flow through the male reproductive system. Okay, so all of these are involved in contributing fluid to semen. And then the last part of this system is the urethra, and the urethra is not only responsible for conducting sperm out or letting sperm exit the male body, but is also what allows urine to exit. Okay, so both sperm and urine use the urethra as an exit. A lot of information on that previous slide, so here's some recap notes for you to pause and jot down. Now, when we talk about that male reproductive system, we give some emphasis to the testes because, again, those are the gonads, very important structure within the male reproductive system. They're responsible for spermatogenesis. So whenever you see genesis, that means the beginning of something. So in this case, it's the beginning of sperm, meaning spermatogenesis is the production of sperm. And specifically within the testes, it occurs in what's called the seminiferous tubules, okay? And it involves both mitosis and meiosis. So mitosis is when cells divide equally. So they double all of their DNA. So it's a total duplication and then split equally so that each of the daughter cells have the same amount of DNA, and then it leads into meiosis where they split their genes in half so that ultimately each sperm cell is half of the genes of the father making them, okay? That's very important, the fact that sperm are produced to have only half the genes of an organism, because what does that sperm then have to do? It has to fuse with an egg, which has half the genes of an organism. And that then makes one whole organism. If spermatogenesis did not involve meiosis to reduce the number of genes, then the organism would no longer be human, or whichever organism it is. Now, I also want to mention that when we talk about sperm, what we mean, a mature sperm cell has a distinct head, middle piece, and tail, which you see right here. So head, middle piece, and tail. It's an important structure because these little guys are motile. Okay, they have to swim, right? They have to move. So that long tail is very important for them. The other point that we make on this slide is the importance of hormones in the male reproductive system. So the hypothalamus, which we've mentioned that structure before, secretes gonadotropic hormones. Okay, so gonad, again, being the reproductive organ. So gonadotropic hormones are follicle-stimulating hormone and luteinizing hormone. And you're going to hear the same names of these hormones in females as well, but they'll have a different purpose. So in males, the follicle-stimulating hormone, or FSH, promotes spermatogenesis in those seminiferous tubules, okay? So FSH promotes spermatogenesis, okay? Whereas luteinizing hormone, so again, FSH promotes production of sperm, whereas luteinizing hormone, or LH, controls testosterone production in the testes. Okay? And testosterone is very important since it's involved in the development and the functioning of the sex organs, as well as secondary sex characteristics such as hair growth and voice changes, and even muscular differences in people secreting these hormones. Okay, so FSH, circle star, highlight that for sperm production hormone, whereas luteinizing hormone is testosterone production. Here's some recap notes in case you had trouble with any of the spelling or understanding what I was saying. Now we move on to the female reproductive system, and just like with the male reproductive system, it's important for you to just briefly know the significance of each of these structures. So first off, we have the vagina, which of course is the site of copulation, again meaning the site of sexual intercourse. And it also serves as the birth canal. In addition to the vagina, females have their ovaries, which will produce the gametes, which again, we said gametes for females are ova or ovum. So you can circle, star, highlight that term, and make a little arrow to remind yourself that that simply means egg or eggs or egg cells. Okay, so it's plural versus singular. Okay. And the ovaries, just like the testes, have two functions to produce sperm and hormones. The ovaries do the same thing. They have two functions, in this case, to produce the egg sex cell and sex hormones, but in this case, the sex hormones, instead of being testosterone, they're estrogen and progesterone. So estrogen is important for sex organs and secondary sex characteristics. So you can look at it as the female equivalent for testosterone, even though I will point out that females and males both have estrogen and testosterone, okay, just at differing levels. Whereas progesterone, the other hormone produced by the ovaries, that focuses on the uterine lining. So building up the uterine lining to create a nice cushioning for if the female ends up pregnant and the baby or the fetus needs protection and to be attached, stuck within, okay? Whereas then when menstruation occurs, you have the shedding of that uterine lining. And this is all basically controlled by progesterone. So estrogen, think sex organs and secondary sex characteristics, whereas progesterone is for uterine lining. Then there's the oviducts, more commonly called fallopian tubes, and that is the site of fertilization. Okay, so that is where the sperm will meet the egg and then allows for the traveling or the movement of the egg through these tubes. So circle, star, highlight oviducts and make sure to note that that is where fertilization is supposed to occur. Okay? Then the fertilized egg makes its way to the uterus, which is the womb, and that's where it then attaches or sticks itself to the lining, and it's the site of development and protection for that fetus. Then at the bottom, the narrow end of that uterus is the cervix, which I'm sure you've heard during, labor. A female cervix will open up or, widen so that the baby then can make its way out. Okay, so the narrow end of the uterus, that is the cervix. And then the lining within the uterus, that is the endometrium. Okay. So when you hear that term endometrium, that's the lining in the uterus. Next, we have the vulva, and that's simply the external genital organ for the female, as well as breasts, which are included in this system because even though males and females both have breasts, in this case of reproductive system, the breasts are important for baby's development because that's where lactation occurs. And we've mentioned lactation before. That's the production of milk, and hopefully you remember which hormone, prolactin, because it promotes lactation. So prolactin is the hormone. Again, recap notes for you to pause and jot down, especially in case any of the spelling was missed. Now this slide is to summarize the ovarian or uterine cycle. A lot of people just think of the menstruation phase, but female cycle is actually 4 different phases. There's the follicular phase, ovulation, luteal phase, and menstruation. The follicular phase is when FSH, that hormone that we mentioned earlier, follicle stimulating hormone, promotes the development of the follicle that secretes estrogen. Okay, so follicular phase is secretion of estrogen. In ovulation then, the follicle bursts and releases an egg that then enters the oviducts or the fallopian tubes. So you see that bursting over here, and you have the release of an oocyte, which is another fancy term for an egg cell that releases into the oviduct or the fallopian tubes. Then you have the luteal phase, and that's when the LH, the luteinizing hormone, turns the empty follicle into what's called a corpus luteum, which you see in this structure here. Okay, that yellowish stuff there, that's the corpus luteum developing. And that's simply a structure that'll secrete progesterone. And as we mentioned before, progesterone is responsible for building up that uterine wall. Because again, if that egg ends up getting fertilized, then you're going to need a nice thick uterine wall to have the developing zygote, or sorry, the released egg, fertilized egg stick to, and then to have the developing zygote protected by, okay? So luteal phase is when the corpus luteum is secreting progesterone and the uterine wall is building up. So you notice in this figure here during the luteal phase, now when it shows the endometrium or uterine lining, it's getting nice and thick compared to over here when it was much, much less. And notice there's a lot of blood vessels throughout there. Then finally, there's the phase that everyone knows of, women more than men because we live with that every single month, and that is menstruation phase. And that's when low levels of estrogen and progesterone at the end of the luteal phase lead to the breakdown of this nice cushy uterine wall, this very thick endometrium. And you'll notice that that thick structure, what did we just say it has a lot of? Blood vessels, okay? All of that now flows out of the vagina, exits the body, and at the end of this menstruation phase, you'll notice that the uterine lining is very low again, okay? Keeps going through that cycle over and over, okay? After menstruation, then you're back in the follicular phase, going through then ovulation, luteal, and menstruation. Here's some recap notes for you to pause and jot down. Now, not everyone wants to have a baby at certain times. You wouldn't want to be constantly getting pregnant. And so there are various means of birth control, but I do point out that abstinence is the only 100% effective method. And of course, abstinence, fancy way of saying, not having sex. That's the only way that you will be 100% guaranteed not to get pregnant. Okay, all of these other methods are not 100%. Now, we have various different contraceptives shown on this page. I do want to point out that with birth control, please be careful, because any medications that are modifying or affecting hormones end up having a lot of side effects. And I've seen a lot of girls have all of these, bad side effects happening to them, especially emotional, related ones, not realizing that it's birth control. And then when they stop taking birth control or they switch methods or whatnot, they ended up seeing amazing improvement and changes that they had no idea that the birth control was having such a dramatic effect on them. I also want to point out, most important of all, that birth control is only to reduce your chances of getting pregnant. Hence why it's called birth control. What's it not called? STD control, because it does absolutely nothing to reduce the risks of STDs. So please, please, please note that if someone is taking the pill, that does not prevent STDs. So you have to pair that up with some other form of protection. Now, on the opposite side of the spectrum, if you're not trying to prevent pregnancy, but instead are trying to achieve pregnancy, there are various reproductive technologies to now help out with infertility, because unfortunately infertility is becoming a bigger and bigger problem, but it's something that a lot of people don't talk about. So a lot of people don't realize that they're not alone in the struggles that they're having to get pregnant. There are various forms to deal with infertility, and infertility simply means the inability to achieve pregnancy. There's artificial insemination, in which sperm from a donor, which can be the partner, is inserted into the patient's vagina to try and achieve pregnancy. There's also in vitro fertilization. So in this one, instead of the sperm being placed into the patient's body, into their vagina directly, the sperm is instead fused with the egg in a lab setting, and then the resulting zygote, meaning that developing cell, is inserted into the woman's uterus. Now, unfortunately, the implantation rate is only around 15 to 20%, so it is not guaranteed to actually take one's place inside the woman's body. There's also gamete intrafallopian transfer. That's the same as in vitro fertilization, except instead of being placed in the uterus, the zygote is inserted into the oviduct, and then it has to travel into the uterus on its own and try and embed there. There's also surrogate mothers, and that's when a woman is paid to have a baby for someone else. Okay, so it's usually not her sperm and egg in some cases, and in other cases it may be as well, but they try to avoid that because of the legal issues that can be involved later on. So surrogate mothers, the woman is paid to have a baby for someone else. And then there's intracytoplasmic sperm injection, and that's the picture that you see over here, especially right here, where a single sperm is injected into an egg to watch for the development of the zygote as it's starting to split those cells. Okay, so various forms of trying to deal with infertility. But again, unfortunately, they don't have 100% rates, and it sometimes takes quite a few trials. And some people that I've known who've gone through these situations, it's actually amazing how sometimes they'll have multiple miscarriages or failed pregnancies during this time. And then after, when they thought that they've given up and they've stopped the treatments and all, boom, they suddenly get pregnant on their own, as if their bodies just needed that shock, that, a little help to get things going. And then they ended up having beautiful, healthy babies after the fact. That was a lot of information, so here's some recap notes on the key points. Now we get to the fun part, the very traumatizing part of reproductive system infections. Okay. Now, first off, I want to mention that women are more affected by infections than men, but even though we say that they're more affected, both genders still have a ton of infection rates. It's getting very, very high and out of control nowadays, unfortunately. Now, the reason why women tend to be more affected is because the vaginal lining is thinner and more delicate than the male reproductive system. Okay, so in that, having that interior organ versus the kind of more exterior organ of the males. It's also a moister region compared to the skin of a penis. So if you think of microbes, they really like moisture and warmth, which is basically what the inside of a vagina is like. I don't know any other way to phrase it than that. Another difference between women and men when it comes to these infections is that when a female gets these kind of infections, sometimes the symptoms actually go unnoticed, because for women, they've gotten so used to the discomfort of their period that they kind of tend to shrug things off as, oh, it must just be related to my period, it's fine. Whereas men, if they have any difference in feeling in their penis, the slightest bit of pain, they're going to a doctor. They are. Okay, so that's also a difference with regard to these kind of infections. Now, I do want to point out that a lot of these infections are spread while people are what they call asymptomatic. And that means that you can give or get infections from someone who's not showing any symptoms. And unfortunately, a lot of STDs stay in your body for life, even if they may not be active at every moment. So you can get these kind of infections in monogamous relationships where you think, oh, just because I'm married, I'm safe. No, you're not, because you never know what other partners your partner had before you. And so you can get infections that are spread even though you are in a monogamous relationship, because they were latent in your partner or they had that from previous partners. Also because everyone cheats as well. Moving on, a point I want to make is that STDs are getting more and more rampant now, and they're very difficult to control for a lot of different reasons. First of all, there is a major lack of proper sex ed. okay, including the fact that the youth, especially college-age students, do not realize that STDs are not only spread from regular old penis and vagina sex. Kissing, oral, fingering, and anal all allow you to catch STDs and to spread them to others. So that means, for instance, giving or receiving oral sex can transmit an STD. Okay? The other big problem of why they're so rampant is what I was just talking about, the fact that not all of the people suffering from these infections show symptoms. Okay? A lot of women are actually asymptomatic when they transfer to their partners. Okay? Meaning they're not showing any infections. You can get herpes, for instance, from someone who's not showing any sores at the time. There's also a lot of societal pressures and the hookup culture of a whole lot of access thanks to the internet, social media, all those dating apps, as well as increased density and mobility of people. Think about, how many people are available to you and how, with the touch of your cell phone, how many different options you have for sexual partners nowadays. Plus, it's also difficult to kind of change human sexual behaviors. So unfortunately, you can tell people that these infections exist, but you can't really control what they're doing in terms of safety. Furthermore, there's a big absence of vaccines for most STDs or, sexually transmitted infections, with the exception of HPV, which has a vaccine now. Okay, so please be careful when it comes to these infections. We're going to go through a whole bunch of examples, and you'll see with these examples that, unfortunately, the choices you make when you're younger and you think you're invincible, they catch up with you, okay? So please do be careful. We're going to start off with some bacterial examples. The first one is syphilis, and yes, this still exists. A lot of people only think of, way back when they hear syphilis, but this still does exist. The cause of this is a bacteria known as Treponema pallidum. And what's important on this slide are the terms horizontal versus vertical spread of infections. So a lot of STDs can be either horizontally spread or vertically spread. For horizontal, you can think of the horizontal mambo, aka sex. So horizontal spread means an infection spread through sexual activity, whereas vertical, you can picture a baby plopping out of a woman standing up, because vertical is the spread transplacentally, meaning from mother to fetus. Okay, so horizontal spread of infection means through sex, vertical means from a mother to her fetus. And syphilis is one of the infections that does go latent, meaning it goes dormant in your body, so you're not aware that you currently still have it. A lot of times they like to go dormant in the nervous system, and then boom, they start replicating and replicating, they become active again. And that's why the later stages of syphilis can be so problematic, because now it's gone to your nervous system, it could go to your brain, and it can even cause basically what they call syphilis insanity. Not a fun time. The next one is gonorrhea, and gonorrhea is one of my favorites, and I know it's weird for someone to say that they have a favorite with STDs, but for me, after all these years teaching microbiology, I love gonorrhea because of the nickname, the clap. So if you've ever heard the clap, there are actually two main reasons why this came about for gonorrhea. One is because gonorrhea was originally associated with clapiers, which is the French word for brothels. So if you think about it, brothels, places where the, pay for sex occurred, that was a big place of transmission of this infection. The second reason gonorrhea is called the clap, and I usually love teaching this in person because all the students get to see the look on the boys' faces when I tell this story. So the reason it was called the clap is because, as you can see, it produces this pus coming out from the tip of the penis. And so doctors back in the day, they thought, okay, that's a sign of infection, so we need to get that out of the body. How did they get that out of the body? They would take the penis and they would place it on a table. Then they would take a heavy book, such as, picture a medical dictionary, and boom, they would clap it against the penis on the table to try and expel, make the infection shoot out of the body. Now, unfortunately, that did not work. And one of the semesters I taught this, a student raised his hand and he looked horrified, and he basically said, well, how many times did they do this before they realized it wasn't working? And I do not know the answer to that, but I do think of that every time I teach it. But thankfully, eventually they developed antibiotics, and they realized that treating with antibiotics is a little easier than, clapping a hard, big, heavy textbook against the penis. Now, with the clap, it is caused by this bacteria here, Neisseria gonorrhea. And I point out that, like many STDs, it does not survive well outside of the host, which is why it is transmitted sexually, in close contact. It's not going to be airborne. Also point out asymptomatic transference, which again means that a lot of the people spreading it, they don't show symptoms. So you could catch it from someone who does not have pus coming out, or who does not have the lesions that you're seeing in these pictures. The other big point that I want to make is that there is the horizontal and vertical spread, just like with syphilis. So gonorrhea can be spread through sex horizontally or vertically to babies, right? Now, when we talk about the vertical transmission, this presents two big problems for women. If a woman has gonorrhea, first of all, if she is pregnant and through the birthing process, the baby gets exposed to this infection, the baby can be born with conjunctivitis. Okay, meaning how does this usually present in newborns? Conjunctivitis, which is the fancy way of saying eye infections. In addition to that, gonorrhea and many other STDs cause a big problem for women called infertility that we just went through. The reason why they cause infertility is because they lead to scarring of the reproductive organs. So you may think, oh, okay, yeah, I had an STD, but I cleared it up with antibiotics. I'm all good to go. I'm fine now. No, because later on in your life, if you decide you want to have children, it's going to be a lot more difficult for you, because you can't see from the outside the kind of scarring that infection did. And it's kind of funny because I was watching the news one time with my nana, and older people, they say what's on their mind, and there was a news segment on how rampant infertility has become. And my nana just turned to me and she looked at me and she goes, yeah, that's because all these girls, they're having so much sex before marriage nowadays. And, I laughed at it because that's, the old-fashioned way of thinking. But she didn't realize that in a way she was right, because the more partners you have, the more, the less selective you are as well with your partners, the increased chances you have of getting STDs. And the more STDs that you've encountered, even if you're not showing any symptoms on the outside, they could have done some major scarring on the inside and cause infertility problems down the line. And that brings us to our next example as well, which is chlamydia. And chlamydia is another infection where the two big reasons that chlamydia is such a big problem for women who want babies is that it leads to conjunctivitis, so again, eye infections in babies, and infertility because of the damage that it does to the reproductive organs. Okay, so again, you may think that you're young and invincible and just having fun, but trust me, with biology, it comes back to bite you in the butt or elsewhere later on in life. So please emphasize in your notes the two issues, the two big problems for women when it comes to STDs, conjunctivitis in the baby and infertility. These are just some examples of some other STDs that are not as well known but do occur. There's chancroid and donovanosis. I just want you to be familiar when you see this word here, Haemophilus ducreyi. That's a bacteria that causes chancroid or soft cankers, which are ulcers along the genital region. versus Klebsiella granulomatis. I always mess up on that bacteria, but mainly when you see Klebsiella, think donovanosis. And donovanosis also causes ulcers, but this is granulomatous, which basically means a lot of times they have a harder kind of clumped appearance to them, and they bleed a lot on contact. Now, with either of these infections, whether it's chancroid or donovanosis, please know be able to see this term, this bacteria, and know that's what causes chancroid. Klebsiella is what's cause of donovanosis. And the reason why I emphasize these is any of the STDs causing ulcers, as you see in these lovely pictures, means that that person is now prone to secondary infections, because when you have any kind of opening on your skin like that, it's very easy for other microbes to enter there and to try and infect you. There's also a lot of viral examples of STDs, and keep in mind the STDs we cover in this lesson is not all of them. There are plenty of other infections that you can get, but I want to just give you a sampling of some. One of the big ones that everyone usually hears about is genital herpes, and it's kind of scary how big of a percentage of the population, not just in America, but worldwide, has herpes of either the type 1 or type 2 form. Now, what I emphasize up here, type 2 herpes used to be the form of herpes found on the genital region. So it caused lesions and sores on the genital region. So circle type 2 or herpes simplex 2 and write initially was the genital region. Whereas type 1, HSV1, was initially up top on the mouth region. So there would be cold sores and lesions on the mouth. So 1 was up top on the mouth, 2 was down in the genital region. Interestingly enough, nowadays they find both types in both locations. So they're finding a lot of type 1 and type 2 in the mouth region and the genital region. And why do you think that is? Again, the idea of oral sex transmission. You know, a lot of students, I make the joke that they seem to think like, oh, no, you know, oral sex, it's not really sex. I can't, you know, get STDs that ways. What do you think? Do you think a virus or a bacteria will look at a mouth and say, ew, gross, I'm not going in there. I only like penis or vagina. No, a hole is a hole when it comes to bacteria, viruses, and fungi. So they will have no problem, you know, transmitting to that location as well. Now, herpes is scary for a few reasons because, first of all, as you probably know, it is for life. It goes latent in the nerve cells, in the nerves, and then eventually it reactivates, usually when you're either under stress or if you become immunocompromised, okay? So if you're fighting other infections, all of a sudden you'll have a bout of herpes sores popping up. Now, I do want to emphasize the fact that a lot of people have the misconception about the spread of herpes. You can get or give herpes even when no sores are present, no symptoms are present. So someone can look like they have no sores on their genital region or mouth, and you can still get an infection from them if they have it within their body. Now, this is scary because it has become one of the most common STDs, with nearly 800,000 newly infected Americans every year. That is a crazy large number of people. And what's scary is the more they study STDs, they're finding that not only do some of these stay latent in your body and pop back up, but they cause other issues as well. And a lot of STDs are being linked to cancer down the line. So please be careful about your sexual practices and about keeping yourself safe. Another one I want to emphasize is HPV, and I want you to circle, star, highlight the red bullet point on this slide because HPV stands for human papillomavirus. And any of the papillomaviruses, they're known for basically causing uncontrolled cell growth, which you see as warts or as tumors. Now, sometimes they can be benign, meaning they're not cancerous, but sometimes they can become malignant, meaning cancerous and problematic. Now, I want you to circle, star, highlight that bullet point that's in red, which asks you, what is HPV the leading cause of? It used to be that students would only answer with cervical cancer, but it's no longer just the leading cause of cervical cancer. It is now the leading cause of cervical cancer, throat cancer, and anal or rectal cancer, okay? So you have cervical cancer, throat cancer, and rectal cancer, okay? And usually you can tell that it is an HPV infection or cancer based on the warts that are present as well, okay? That uncontrolled cell growth. Now, thankfully, there is a vaccine developed, and they used to only give it to younger people, basically assuming they're, targeting the people before they've been sexually active. But now they allow even older people to take it to try and reduce the spread of HPV or reduce the number of people who get it because of the fact that it's causing so many cancers, and people do tend to die from these cancers because they tend to be very aggressive, especially the throat cancer. But all three of them, cervical cancer, throat cancer, and rectal cancer caused by HPV, is leading to a lot of death. And it's especially sad because you'll read a lot of articles where, for instance, a woman or anyone, because anyone can catch it, but there are a lot of cases where someone catches it even when they're married and they think that their partner is monogamous. They were not aware that the partner was cheating on them. They catch HPV from them and they end up dying from the cancer that is eventually caused from this infection because they didn't know that their partner was cheating on them. And so it's become a very sad type of infection, HPV. Again, the vaccine does exist. It is a vaccine, so it's only preventative. If you have HPV already, the vaccine will not help you. It used to be a vaccine of 3 shots where you had to go back after a few months to get the later shots, but now they're finding that even 1 dose of it has greatly reduced your chances of HPV and the various cancers associated with it. Note that there is no cure for HPV, but there are ways to treat the warts that pop up, which are listed out here. Some of the other big viral infections that are sexually transmitted include HIV and hepatitis. There are tons of things that we could talk about with HIV, but this is again just general course where I just want to give you a sampling of everything. So for HIV, I want you to know it stands for human immunodeficiency virus and ultimately leads to AIDS, acquired immunodeficiency syndrome. What this means is HIV is the infection, the viral infection that you get. This viral infection, the viruses attack your helper T cells, okay, meaning it's attacking your immune system, greatly reduces the number of white blood cells you have to protect your body, and eventually when your immune system is very low with very few helper T cells, then you become categorized as having AIDS, which is the acquired immunodeficiency syndrome. So the infection is HIV, but when you have the lessened immunity, that is then AIDS. And note that there is still no cure for it. Even though you may hear some things on the news, those are not true official cures yet. There's also hepatitis, which is not just an STD. There are various ways to get hepatitis infections, such as drug use, sharing needles, for instance. But what I want you to know about hepatitis is it's a viral infection that targets the liver, okay? And there are different forms of it, multiple which are sexually transmitted. Now, seeing as I ruined sex for you, I also would like to ruin kissing as well. One of the big infections on college campuses is mono. So on college and high schools, unfortunately, a lot of students are getting mono, which is caused by the Epstein-Barr virus. And I want to point out, because a lot of people take this very lightly. They used to call it, kissing disease, and they thought it's not such a big deal. Unfortunately, EBV is a form of a herpes virus, meaning it's a type of virus that goes latent in your body and causes trouble down the line. Now, there are a lot of things that mono is known for. First of all, it is targeting your B cells, so it's targeting your immune cells, and it tends to cause extreme fatigue, fever, sore throat, and aches when it's highly active. But now they're finding that when it remains with you for life, it also causes chronic fatigue syndrome and multiple forms of cancers, including B-cell lymphomas and nasopharyngeal cancer. So in the nose, the nose and pharynx region, people are getting cancer from having EBV in their body. So it's not just, something to be taken lightly. Oh, all the kids have it. It's just kissing disease. No, it stays with you, and it can cause things like chronic fatigue syndrome and cancer, specifically B-cell lymphomas and nasopharyngeal cancer. So again, like I keep saying, please be safe with the decisions and the choices you make, because the fun you have now, some of the stuff you get lasts with you for life. It's not so much fun down the line. Now I just want to mention some fungi and parasites that are sexually transmitted as well. We have vaginitis and urethritis, so whether the vaginal region or the urethra are infected. The fungal culprit is Candida albicans. So whenever you see Candida albicans, I want you to know that is a fungus, specifically yeast, that causes yeast infections. The other thing I want you to know about yeast infections is that they can be sexually transmitted to male partners, because so many times when people think of yeast infections, they only think of vagina. But through sexual contact, a male can get what's called balanitis, and that is a form of yeast infection from Candida albicans, which is the inflammation of the foreskin and the head of the penis. So it's basically an infected penis tip, which includes discharge and pain and itching and dysuria, which is, pain and burning during urination. Okay. Now keep in mind, Candida albicans is actually part of the female normal flora, so it's not always sexual transmission that will cause a yeast infection. In fact, a lot of females have cyclical, menstrual yeast infections or temperature, weather-related yeast infections, because all different things can cause an overgrowth of that yeast that's normally found in the vaginal region. The last thing I want to point out is a quick sample of parasites that can be sexually transmitted. So two main parasites that can be sexually transmitted, they are arthropods, okay, meaning little insects, little mites. They are Thrypus pubis and Sarcoptes scabiei, basically called crabs versus genital scabies. And what's interesting about these is they like hair regions and skin, and they don't care where it is. So you can get a sexually transmitted infection of pubic lice or genital scabies, these little parasites, and they can go elsewhere on your body. So they can go on even your eyelashes, which is what this picture is, infected eyelashes. So thankfully, they've created shampoos, permethrin is one of them, that work by paralyzing and killing the mites and their eggs, but you don't want to catch these. So again, be careful with your decisions. So now that I have traumatized you, you have made it to the end of this course. You are almost done. You just have to make it through the final last couple of exams to take. So as always, any questions, please contact me in the Remind app. Make sure you are finishing up your study guide to upload. Make sure you're finishing up your last discussion board posts. And please make sure you're reviewing for the exams. Okay? It has been a pleasure. Thank you and have a wonderful day now that you've been traumatized. My work here is done.